confirmed cases. That's a total of 135 confirmed cases of COVID-19 on Guam.
And again, this information has been confirmed by several mayors this morning. Of course, Mayor Melissa Zavaris, who is the president of the Mayor's Council of Guam, told us that this information was presented to mayors after they've made repeated requests for more transparency from the governor's office and the COVID-19 response team. And I think it's good for all of us that we're now getting that transparency. It's tomorrow standard time, I guess. 8:52. Now we go to our man in the CNMI, Tomas Manglotnia. Good morning, Tomas.
Good morning.
Good morning.
I guess we'll just let you do your report, and then I wanted to ask you a couple questions about your interview with Kalili. So again, with the latest on the situation, COVID-19 and the CNMI, Tomas Manglotnia. Good morning, Tomas.
Good morning. So the latest on containing COVID in the CNMI, an update as we head into the weekend. As of April 17, the CNMI has 13 confirmed cases of COVID-19, 2 deaths, and 9 recoveries. And first, starting with the public school system's Grab and Go meal program, that started again on April 16. They resumed all Grab and Go meal programs for Saipan, Tinian, and Rhoda. Free meals for all children of the CNMI, ages 18 and below, Monday to Friday, 9:30 a.m. to 11:30 a.m., 1 meal per child while supplies last. Also, with the local CNMI government getting a clearer picture of the numbers in the government, approximately 6,000 employees represent the entire CNMI government. The governor's office yesterday telling us that terminated and furloughed numbers are approximately 50% of this figure, so it's an estimated 3,000 who are affected. And more news from U.S. Congressman from the NMI's Kalili office. FEMA leadership shared the most recent worst-case projections with Congressman Kalili last night for the NMI. According to the Johns Hopkins University model, it shows a possible peak of 6,000 cases in the Marianas by the end of May to early June. He said that we can change it if each of us do our part. Again, Bree and Chris, we spoke with Congressman yesterday. It's a very revealing and telling interview. You can watch that full interview now streaming on KUM News' Facebook and YouTube page. We talked about the CARES Act, government cuts, the public school system, and retirees cuts. And he tells us that he's presuming to run for re-election in this next cycle.
Yeah, that was a good interview there, Tomas. A lot of insight into Congressman Kalili and the efforts, of course, to contain and battle the coronavirus, both on Guam and in the CNMI.
Definitely. That was 38 minutes worth of conversation. He talked a little bit about his communication with the local COVID-19 task force here, saying that basically, he's only received written communication, and he's working with Michael Nicholas, the congressman, of course, there from Guam, on more help on the way for the territories.
Mm-hmm. Has there been any word on when there's going to be any sort of a media briefing with the governor?
Every time we've asked the governor's office, we're told, wait and see. I think this week, Bree, if I'm correct, it's been 3 weeks since the last briefing, so we haven't had that chance.
Okay. I mean, I noticed he's really stepped up on Facebook doing his reports from different places, so I just didn't know if he was going to be actually addressing the media instead of just, putting out this one-sided information.
That's the trend, though, Bree. I guess if you go around the nation, a lot of...
well, that's one way to control the message, right?
Yeah, definitely. And what's your take on that, Tomas? Is that something that the people in the CNMI talk about? That the governor there is not willing to, engage with the media?
I have to say, though, that there are one-on-one interviews that are being offered. I got to give credit to the hospital CEO, Esther Munoz. She's agreed to practically weekly, if not, several interviews in 1 week. In fact, just kind of on the same topic, I reached out to her to ask to talk to a doctor with regards to the South Korean test kits. We know that a pathologist from South Korea is training members of the CNMI hospital on how to use that. And so we hope to get that out next week. But with regards to the governor himself, we haven't had that press conference, since about 3 weeks now. And folks just want to hear the daily updates. And, as Bria alluded to, those, edited, highly produced, elaborate videos on Facebook aren't really cutting it for people in terms of getting the information. There might be, some nice background music, but we really just want the background info. So that's what I'm hearing here.
I like that, Tomas. So But when you if you're going to ask the governor stuff, is there stuff that you can ask? Other people. I mean, are you not getting any information because we can't interview the governor? How are you working around that?
We're just, I talked to the mayor of Tinian, talking with the hospital as well. And I think that, a lot of the other officials are willing to talk directly. I think, though, that, we've been giving points of contact, and we're just hoping that, the point of contact can ultimately be, the governor himself, who can share information directly on what he's working on.
Okay. Well, good luck, and hopefully, we could get this interview with him.
Yeah, I've got to give it to, I've got to also give it to Adriana Cotero with the KUM news team because, she was a reporter here before and she's continuing to ask. She's also helping with the coverage in the CNMI when she can. And so, the request has been put in. I think Chris, joked last week, Adriana's been asking for a year. So we're hoping if that happens, I hope she gets that interview when she can.
All right.
All right, thanks, Tomas.
Yeah, so what are you working on for today, Tomas? What kind of info are you trying to track down for the people in the Marianas?
Yeah, and so as I was sharing with the news team, we're following up with the CNMI government on the exact date for those 40,000 more test kits. I know we've reported that it's going to be in the CNMI by the end of the week, but we're going to see if, when that actually arrives, get more information on that. We also want to know about the cost of the kits. I know this was something that other media are also looking into. How much are exactly these kits? We know that the CNMI governor's office told us that these are FEMA reimbursable funds, so local funds were used to purchase them. And like I said, I'm working on getting more in-depth interviews. I want to definitely talk to a medical professional who's actually using these kits and not just talking about them or reading about them. So I'm in talks with the hospital to get a medical professional on island who's going to be actually using the kits or training other folks on how to use that.
Tomas, what do you make, and have you seen any comments by the governor there in the NMI in response to what our governor here on Guam had said when asked about the South Korean test kits? I mean, she was pretty triggered, and I think that you can kind of tell that this is just a no, hard no, and I believe she said, I don't know if it was yesterday or the day before, that it's a dead issue to her.
I was sharing, with, as we reported through the week, the officials in the NMI say it's a highly accurate test, and they're using it again for surveillance and containment through a community-based testing. And I think where it might not add up for folks is that, we've got countries, cities, Canada is putting it on its official list. And so I think there's just, if not, just a healthy amount of skepticism as to the resistance on it. I think the phrasing we're hearing is U.S. FDA approved, and I think that was especially outlined in yesterday's show about, how it can be used and not used.
Well, I mean, it's interesting that they're saying they don't want to use these tests because they're not FDA approved when the tests we're currently using are also not FDA approved.
They're
EUA, yeah.
We interviewed Esther William earlier, and in that full interview, I posed that question to her about, the fear for false negatives. That interview is on, that full interview is on KUAM, and we did that interview on April 14, I believe, and I pressed on that. I said, people are concerned about false negatives, and she had no hesitation in saying that of course false negatives are always a concern, but they're going to be validated by the U.S. FDA approved ones.
Right, and these were for surveillance purposes.
Right.
Yeah, and again, I don't think it's lost on us that we saw that New York Times report saying that now the U.S. is going to receive 1.5 million of these tests from Solgen, that same company. And, I don't know, maybe trying to get someone from Solgen to speak with us, but, we just got to get more clarity on this.
Yeah, well, did you hear what the Assistant Secretary of the Interior, Doug Domenech, said? He had actually referenced those test kits and, talked about them being delivered to the NMI, and I thought that was pretty interesting.
Yeah, it was, and, it's people tell us to turn to the doctors and the experts, and it seems like we're also along that same spectrum of not really knowing when we talk to doctors and experts. So, I hope that's why I hope to get that doctor who's actually using the kit to clarify even further, even if we've got that long interview clarifying the use of it in the CNMI with Esther Williams.
Right.
And I got to rewatch Dr. Ho Wynn's interview because he made it sound like there were these test kits from South Korea that came in, they confiscated them, a wholesale company brought them in, they confiscated them, and now they're going to use them to do Studies?
Yeah, studies.
Yeah,
And he mentioned something with the University of Guam. That was some new information. We get a lot of new information here on the show. That's why it's important for
And I
our
believe
viewers and our
somebody from
listeners.
Sargent is on Guam. I believe that's
Yeah.
what he said. So,
And Tommaso, what I asked you about with the reaction with the governor, or maybe if you can ask the press secretary, is that our governor here had basically said when asked about using these South Korean test kits, I think her response was that she didn't want to risk anything and risk the people of Guam by using these tests. And I mean, to me, that was kind of like alarming because you got 60,000 of them or whatever in Saipan, and the people of Saipan are going to use them, and it kind of, I mean, CNMI, and it kind of, I don't know, if I was in the CNMI and I heard the governor of Guam say this, I might have a little anxiety about, well, does she know something we don't, or because it just really seems like there's something else going on here. I don't
Yeah,
know.
and I think also, the perspective from the NMI too is that we're getting, as last reported, 5 tests a day on Guam in addition to those that are sent off island. So the urgency also, is there in a very different way as well.
Right, and we just tested 12 people yesterday, so there's a lot of talk about how much we need to do mass testing and how we need to test more people, but sadly that's not happening.
and it's primarily, or at least Dr. Hoa was saying, that it's because we're short on test kits and on supplies, but you don't hear that from the government telling you that.
Yeah, I mean, maybe if we had more than 2 questions, we might be able to ask something like that. Okay, Tomas.
Thank you.
Hey, appreciate it, brother.
Thank you so much. Have a great day.
Have a great weekend and wash your hands, okay?
Thank you. You too, Chris.
Okay. There's Tomas Maglonia, Jason.
Well, what was interesting, I didn't want to interject because